Good evening, good evening, good evening. Welcome to the Hub. I'm so excited to join you for 2026. This is where we will discuss health, finances, community, education, and also politics. We ask that you continue to join us here monthly as we have new guests and also different topics that will not only inspire you, but also educate you. The Hub is where ministry and community connect. I am so excited to be able to join you this evening. As many of us prepare to step into a new year, usually we set high goals or we want to step into a different level of wellness, right? But we also want to do things and make choices that help us to have different outcomes for our year. So tonight, as we step into a new year, we want to look at a topic from the mental health arena. Now, we know that we cannot make informed choices concerning our health without proper knowledge. So, we have always tried to make sure that we pull from subject matter experts so that we can glean with the appropriate knowledge and make informed decisions. So, I would like to welcome you tonight to Your Mental Health, Your Choices, a conversation on medication management. Now, some of you may not have even considered that you would need to learn about this topic. So tonight, our guest is really going to help us to get the knowledge as to how this could really help serve you or maybe others that may have in your life that you value. So Dr. Brittany Bagby is a doctor of nursing practice and dual certified as both a psychiatric mental health nurse practitioner and a family nurse practitioner. For over 5 years, she has worked alongside individuals and families across Hampton Roads, providing comprehensive, community-based psychiatric care and supporting people through a wide range of mental health concerns. She is the founder and owner of Sunflower Psychiatry and Wellness, a newly opened outpatient practice in Newport News, and is dedicated to expanding access to high-quality mental health care throughout the region. Dr. Bagby works with children, teens, and adults. She offers personalized, compassionate medication management and mental health care services. She believes care should never be based on a one-size-fits-all model and takes time to truly get to know each person, shaping treatment around their goals, their experiences, and what they need. Whether they are navigating depression, anxiety, mood concerns, challenges with focus, or life transitions such as postpartum adjustment, grief, or major life changes, she meets them where they are and walks alongside them with thoughtful care that's rooted in respect and understanding. She is a strong patient advocate, and Dr. Bagby is deeply committed to making mental health care more accessible, collaborative, and stigma-free. She believes every person deserves to feel seen, heard, and understood. And she strives to create a safe, supportive space where honest conversations can happen and growth feels possible. Now, outside of her professional role, she is the proud mother of two amazing boys. She enjoys reading, attending to her son's sporting events, and spending quality time with family and friends. Facebook community, please help me welcome Dr. Brittany Bagby.
Hello, hello. Thank you so much for having me. I truly appreciate it.
Good evening. We are so excited that you connected with us. So just to get started, just tell us a little bit about your role, with the medication management.
So, what medication management is as a psychiatric nurse practitioner, basically, I evaluate patients, I diagnose patients, and then we come up with the treatment plan. In layman's terms, what I do is I help people understand their mental health symptoms. We explore their treatment options, and then we decide together if medication management is a good fit for them. What I always like to tell people is psychiatric evaluations don't just have to include medication, though. It includes listening, it involves education, it involves referrals. So it involves a wide range of services outside of just medication management.
Excellent. So how would I even know that I would want this assessment, if I was
How
looking for that?
How would you know? There are ways. So if your symptoms start interfering with your quality of life, You're not sleeping right. Your relationships and your personal life are not right. You're not able to get out of bed. You're not eating like you're supposed to, or you're overeating. Your mood is up and down. You're not cooking like you used to. You're not spending time with your kids like you're used to. At that point in time, then you may try to decide, okay, are meds a good option for me? Either, the patient themselves may point it out or somebody around them may point it out. They may have tried coping on their own. They may have tried therapy and that has not been fully effective. And, they decide that they just need that extra layer of support in whatever way that looks like.
Okay. So do they have to have a referral to come and see you?
No, 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 no. Um, if you want to be seen, you can initiate those services on your own. Now, some insurance panels, they do require you to get a referral, but most of them, you can initiate those services on your own. You can call, you can do a consultation, you can inquire, you can ask questions. You do not need a referral to be seen.
Okay. Well, I mean, I can see that sometimes we may experience those symptoms. So, how would someone know that, all right, therapy is not enough? I need medication management.
So it's individual based and it really depends on the person. It depends on how long the symptoms have been present. If it's situational and it's mild, therapy may be okay. If it's more intense though, if it's an impacting your finances, if it's been going on for a long period of time, if you feel suicidal, at that point in time, medication management may be more effective than all of the other options that you may have tried. So that's when we kind of look at the whole picture to figure out what other services may be possible for you.
Understood, understood. Yeah, I know that, sometimes when I hear people talking about medication and mental health, it's a lot of myths that people are really running behind. So, what are some stigmas, I guess, that you help people overcome? Like,
What are some stigmas? A lot of people think that medication would change who they are. It'll change their personality. I will not be the same person that I am if I'm on meds. So I think that's kind of where the education piece comes in for most people, to let them know that medication should not change your personality. It shouldn't change your purpose. If anything, it should kind of enhance those qualities. You may be able to cope better, to have, more effective conversations. You may be able to get better sleep so your energy levels are improved, so you can go to the gym, so you can clean up, so you can shower, like you're supposed to. So I think a lot of people are conditioned to think if I need medicine, something is wrong with me. You know, I think we were conditioned very young that if you need medicine, then something is wrong with you, and that's necessarily not the case. I always say mental health conditions are medical conditions. So the same way you would treat high blood pressure, the same way you would treat diabetes, are the same way that we would treat depression and anxiety and ADHD and PTSD and all of the numerous various diagnoses that kind of come about. So I think those are some of the things that we try to address in medication management. And I think it all includes the education piece, getting out and really trying to destigmatize mental health and explain to people what it really is and what it really involves, and that they have a say in their care. It's just not what your provider says, it's what you say, because it's a collaborative effort for the
yeah,
most part. So I think that's kind of where debunking those myths and those fears kind of come into play.
got you. So, if somebody does need medication, is this something that they're gonna have to stay on forever, or is it titrated to their situation? Like, what does that look like?
That's a good question. And I hear that question a lot. That's probably one of the most questions that I hear. So medication management does not have to be long term. For everyone, it is individualized. So some people may need it for a short period of time. Whether, new moms may have just had a baby, or new dads may have just had a baby. You may have had a death of a, important, a family member. You may have gotten a new job. You may have moved to a new state or a new city. So sometimes in some aspects, medication management can be short term, whether it's 6 months, whether it's a year. But we come up with a plan together so we can kind of figure out what that looks like. And then on the opposite end of the spectrum, you have patients who need medication more long term, and both are okay. So I think that's kind of what I try to instill in people is whether you need it for a short period of time or a long period of time, as long as it's improving your quality of life when you are on the medications, though, that's the most important part.
Okay. So with you talking about that, insurance probably can play as to whether somebody can afford this kind of service. So do you take insurance that's specific or can anybody come see you?
So I do accept specific insurance panels, but essentially anyone can come see me because I do offer self-pay options as well. I do have a part of the business where some people can be seen, for free, depending upon what the extent of their circumstances are, because I really believe in making mental health care more accessible. Sometimes people don't have the means to, pay for health insurance every month. They don't qualify for Medicaid. So, I think addressing all areas of the spectrum, whether it's self-pay, whether it's insurance, or whether it's, pro bono services, they all kind of have to be addressed.
Okay. So how will somebody check that you take their insurance?
It's a consultation involved. So I do have a inquiry form on my website. You fill out your insurance information, your name, your date of birth, and then I verify your insurance to see if I am in network with that panel and if I can see you. There are a lot of non-network benefits. So even if I'm not in network, a lot of times I may be able to see you. It just may be a little bit more of an out-of-pocket cost for that person.
Okay. So you all see that? Hey, if you want to go see Dr. Brittany Bagby, we'll give you her information too at the end of the session today so that you'll be able to contact her. This is this is really deep because I see that sometimes the stigma keeps people from wellness. So how long does it typically take with people that you've worked with for them to really see results from the medication they're taking?
It really depends on the medicine, and whatever medication that we decide. Some people
Mhm.
can see relief within 7 to 10 days. Others, it may take 4 to 6 weeks. Most rules of thumb is about 4 to 6 weeks for us to really see if those positive effects are showing, if you have a reduction in the symptoms that you presented with me when we did that evaluation. So what I always encourage people to do is look for those small changes, whether you're sleeping better at night, you're not waking up as much during the night, you're not as irritable, you're coping better on a day to day with life's inconveniences. So it's all medication related because you do have medicines that are instantaneous. You take it that day, you feel it that day. But then you have medicines that you take and you may not feel it for 2 weeks, So I think it's imperative that the education piece is there because a lot of times if people don't see the side effects happen instantaneously, then they'll stop taking the medicine. But sometimes it takes those medicines a little bit of time to really build up in your system, to really be effective.
Now, is this something that we should be looking holistically at diet and other things as well as medication, or you just focus on the medication part?
No, everything. We look at the big picture. We just don't look at the pill. So we're looking at sleep. We're looking at exercise. We're looking at your diet. We're looking at everything. All of those things play a major factor. Because a lot of times if those things are not adequate, then your symptoms may not get better, even if you are taking a pill. Or if you're taking a pill, it could be make the pill a whole lot less effective. So when we're coming up with your plan of care, we're going over what you eat in a 24-hour span. We're going over how often you exercise during the week. We're going over what does your sleep schedule look like? Do you take time to wind down at night? Are you scrolling on your phone all night? Are you waking up 4, 5, 6 times? During those, spans of time. So we kind of come up with plans outside of medicine just to kind of tackle all of the areas in your life, just to see how we can make everything better, not just those mental health symptoms that are being presented.
Okay, so y'all hear this. When you come for an evaluation, it's going to be everything then, not just, hey, this pill worked for this. So we're going to be looking at really, it's a holistic approach.
It
Okay.
is.
Very nice. So, like somebody who's nervous to even speak up, how should they present themselves so that they can get their needs met with this medication management?
If someone is nervous, try to encourage patients that they have to be their own advocate. The sooner you speak up, the sooner things can kind of be done. Um, if you don't say anything, then we really don't know anything. If you don't say anything, then we really can't make the changes, that are necessary. I find that a lot of people are nervous with medication management because it's a new arena. It's something that they've never done. It's something that they don't know about. And if they have heard about it, the things that they may have heard may not have been, you know, they may have heard someone else's experience. Let me just say that. Or it could have been their own experience in the past, whether there may have been a dismissive, provider who didn't really listen to their concerns, or they felt like they brought things up and they were never addressed. So, one thing that I really pride myself on is really creating that safe space for people to come in, and I can be honest with them and then they can be honest with me, and we can really work as a team to figure out what will be the best choice for the patients in those times. So nerves are normal, but advocacy is also true as well.
Very good. So, like, help us understand how you got interested in this specific, I guess, field.
How did I get interested in mental health?
Mhm.
So was a family nurse practitioner at first. What I saw doing primary care was that a lot of people would come in, they would have high blood pressure, they would have diabetes, they would, have a lot of physical conditions, and a lot of times it was because their mental health was not addressed. They were depressed. They were anxious. Some people may have had delusions or hallucinations. A lot of people weren't sleeping. A lot of people were dealing with like PTSD. So there were a lot of underlying conditions. Um, and I found that to be a whole lot more purpose driven, should I say, than just being a primary care provider. And I also feel like that I have encountered a lot of people throughout my span of 34 years that mental health should have been at the forefront of their life a long time ago, and improving their quality of life over all of the spectrum should be important. So I chose mental health to really improve quality of life because we only get one. So
Right.
anything that I can do in that aspect, that's kind of what I want to do.
Awesome. And see, I really wanted you to share that so that people would understand that there actually is a whole new wave of professionals in this mental health arena that have that same sentiment. A
Yes,
lot of people that I'm working with, they really want to have mental health accessible, but also change the paradigm of what people think. Like, your wellness matters,
it does. It
you
does.
know? So I really love that. I really love that. I think that's what really drew me to really want to talk to you because you exude that through how you communicate. So
Thank
I
you.
can only imagine how your clients feel sitting across from you. So that's really good. I hope that you all will take advantage of this resource if you definitely have something that's resonating with you that Dr. Bagby has brought up tonight. So I wanted to kind of shift gears a little bit. With us dealing with different clients as professionals, right? Sometimes their cultural and their spiritual, and family beliefs can dictate how they get care and they deal with us. What have you seen, with your experience concerning like cultural beliefs, spiritual beliefs, and family beliefs?
What have I seen? I've seen that everybody or every client is totally different and what they believe. Everybody has different cultural beliefs. Everybody may have different spiritual beliefs. But we talk about those things during the evaluation so I can make sure that that is involved in the decision-making process. I never want people to think that they have to compromise their values or their beliefs. For medication, for therapy, for whatever approach that we come up with. So I try to incorporate those things within the plan of care so they feel comfortable. Because the main thing is comfortability. If people don't feel comfortable, they're not gonna come back. You may see them once, but you may never see them again. And if they're coming to see you, then, their mental health, ultimately there's something already going on. I don't want to make them have to have another battle in whatever way that looks like, whether it's their values or whether it's their beliefs or whether it's, from a cultural aspect.
Okay. Very good. Yeah, and I hope that you all will understand that this is a broad subject. So you may get people who are super spiritual, and you may get people who, hey, I don't want to talk about that. It has nothing to do with me. So it's a very safe space. So I hope that you guys will understand that you can get your needs met. Very, very good. So there are some specific topics that I want to highlight. So let's talk about maybe an anxiety client presents to you. What are some options that you have given them to deal with the anxiety?
What are some options that I have given them to deal with the anxiety? So, what I can say is when I see most people for an evaluation and they're thinking about meds, therapy is always on the table for me because I always say if we took medications away tomorrow, then what? Do you have you developed those coping skills? Have you developed those grounding strategies? Have you identified a therapist where you can kind of go to and actually peel back the layers of those racing thoughts, of those negative thoughts? So therapy is always, first and foremost. Um, what else have we done? I mean, of course, medication management comes into play. We kind of address those spiritual factors, what that looks like, your support system. What does your support system look like? Do you have somebody that you can talk to? They may come see me, once a month, once every 6 weeks, once every 3 months. But do you have someone that you can kind of talk to on a day to day? And what does that support system look like for you? Um, what else if I have an anxiety patient, what would I do? Um, I would point them to other community-based resources as well. We have mental health skill building. A lot of people do mental health skill building where they have workers come out and they help them fill out applications. They take them, they make sure they get to those appointments. We come up with crisis plans, which basically we look at what happens if you're in a crisis and your anxiety is really high and you're having those suicidal thoughts. Who are you calling first? What is going to be your who's going to be your first point of contact? What's going to be, what's going to be the first thing you do, even if you cannot effectively think in those moments. So we just basically kind of look at everything from the top to the bottom.
Very good. So you all hear that, right? The pills are not the sole part of medication management.
Not at all.
Wow. This is very, very good. So anxiety is something that, majority of people have dealt with. So how about depression? Is that something that is gonna have to have me on some long-term meds to manage that?
No, and again, it's individualized. Depression, sometimes depression has different driving forces. Sometimes depression, we don't really know why we're depressed. There has been nothing that happened. There has not been a death. There has not been, a loss in any sense. There has not been you haven't lost your job. You haven't lost a friend. You're not sick with a debilitated disorder like cancer or high blood pressure or diabetes and things like that. So with depression, we're just basically looking at the whole picture as well about, really what's going on and how we can improve that quality of life in whatever way that looks like. So meds can be one, but therapy is also a good arena. And always, there are always different types of therapy. And I think most people, they revert to kind of talk therapy where they're doing all the talking and someone else is doing all the listening. But I think, those different types of therapy need to be tapped into because sometimes you may not be doing any of the talking, but somebody else may, be doing the talking to really kind of teach you the strategies and the methods for you to be able to live a better quality of life on a Monday through a Sunday, to be able to have more better days than bad days. So that's kind of what we look at when we're addressing depression in that aspect.
Okay. So it's still that holistic approach.
It is.
So for people who may have these bouts of depression, are there pills that they can be prescribed that just as needed?
So essentially, we have some, over the counter things that can be taken as needed, but anything that you're prescribed for the most part is something that you have to take every day. It's not just a sometime thing. And by sometime, I mean if we've come up with a plan and we take something for 6 months, that's what we come up with. But taking a pill Monday through Thursday and then not taking your pill Friday through Sunday, that is not how medication management works.
Okay, so y'all hear that. So we need to have consistency.
Yes.
So it sounds like we're looking for this medication to really help regulate internally then.
Yes, 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 yes. So, in hindsight, really something that I'm supposed to know and not so much what everybody else is supposed to know. So we're looking at certain neurotransmitters in your
Very
brain, whether it's the serotonin, whether it's the dopamine, whether you know, any of those neurotransmitters, we're looking to kind of increase those. So the sun shines again. We're creating some rainbows and no storms. Those energy levels are a little bit more activated. You're able to really calm down at night to have that restful night sleep. Um, so yeah, those are the things that we're looking at.
very, very good. So like if I'm like, hey, I'm just used to this now, Dr. Bagby, I'm used to this. How do I know that I need medication? Like, I'm used to this.
Yeah.
How can we like, is there some vital signs or is it just symptoms and them measuring what feels off to them?
Yeah. I'm used to this. A lot of times the question that is presented is, although you're used to this, is this how you want your life to look? Is this what
Ah,
you desire for yourself? Is this the quality of life that you envision for yourself on a day-to-day basis? So just because you're used to something doesn't mean that it's normal. Doesn't mean that it's right. Doesn't mean that this is how you should feel, on a day-to-day basis. So, I feel like change, if we all stayed the same forever, then nothing would change. So nothing changes if nothing changes. You really have to identify how you want your life to look and then come up with those with that plan of care and how things can kind of be different.
that's really good. That's really good. So listen, if you know that something just feels off to you, come get assessed. Now, it won't do them any harm if they meet with you and you say, you know what, I don't think you need medication right now, right?
No, it won't do any harm. And a lot of times, the first time I see a client, medication may not even be on the table. We may come up with a whole new plan of care. I may give you referrals to a therapist. We may come up with a 7-day timeline on what it looks like for you to eat healthier, for you to get in the gym. I may send you to your primary care doctor and we may get your labs looked at because sometimes labs can play a factor. Your B12 might be low, your vitamin D may be low, your thyroid may have some issues. So medications don't always have to be on the table in that first visit. And what I always encourage people is you don't have to make a decision during that first appointment either. You can take time to think about it. If you're not sure about something, you can say, okay, you've asked all your questions, and even if you didn't, you can always call later if you got more questions. But taking that time to really figure out what it is that you want to do, and giving the patient really that autonomy and that decision making on their own, that's the most important decision. So medications do not have to be on the table at all.
Wow. I love that. I love how you present that the client is in control. And I think people need to keep hearing that. You are in control of your mental health. However, you need to be honest,
For
right?
sure.
So,
Yes.
are there some predisposed, like biological factors that, like, if your mother took medication, then maybe I should expect to take medication as well? Like, is that something that's a reality?
Yes. So heredity can play a major role in, some mental health conditions. So if your parents or your grandparents or, your aunts, your uncles have some conditions, then, we can identify where some of those things have come from. A lot of times people in your family may not have any, mental health diagnosis, and you may be the first person to experience some things. It could be that some things happen while your mom was pregnant with you that can cause, certain mental illnesses as you continue to get older. So those biological factors definitely can kind of play a role. There can be some environmental factors. A lot of homes had lead in them, years ago. So sometimes some conditions kind of come about, from those things. So yeah, there are a lot of factors that can kind of contribute to those conditions outside of those things just kind of organically happening and us not really having a rhyme or reason why those mental health conditions are present.
Wow. So, with you saying that, thinking of maybe somebody who's preparing to start a family, are there certain things that they should do before they get pregnant, or is it just wait and see?
I think that's where the transparency comes in, between you and your partner. But it also involves transparency amongst family members too, because a lot of people really don't know, those diagnoses that their mom may have, that their dad may have, that their grandparents may have. So I firmly believe that there are some honest conversations that may need to be had during those times, whether it's amongst family or whether it's amongst family planning. A lot of times you can be proactive. Just because you have a condition or your spouse has a condition or significant other, that doesn't necessarily mean that your child will have that condition. Um, so what I always say is you can't base somebody else's experience off of what your experience will be. It could just be a wait and see thing, but again, you have those resources out there that will be able to help you if something comes up in that process, whether, a child presents like, okay, well, my dad is bipolar, so maybe I have a little something going on. But that's when evaluation comes into play. And we can kind of pinpoint where, the symptoms may have stemmed from, if they stem from, anywhere at all.
Okay. Well, I know, like, I'm only 44, and I know the generation before us, mental health still wasn't, something that was acknowledged. So, what are some questions you can ask your mom or father or grandfather to get, I guess some kind of help with being proactive?
What are some questions you can ask? You can ask about what the day to day look like around them. Were they always angry? Were they always sad? Did they isolate a lot? Were they withdrawn? Um, did they overeat? Did they overcompensate and always stay busy? Were they hospitalized at some point in their life as it relates to their mental health? Did you see them taking pills that might not have been for, medical conditions? Were there any suicides that took place? Was there any substance use that took place? I feel like when people are asking certain questions, either they can be easy questions and people can answer them, or there may be a little bit more harder and difficult questions that people may not want to answer. But transparency helps a lot in those areas because it kind of helps get down to the root of the problem as to why that person may be asking those questions.
Very good. Yeah, I see a lot that the unspoken and kind of not talking about different kind of abuses
Right.
really keeps a lot of stuff hidden. So have you seen that abuse is prevalent in maybe a lot of people who have been coming and seek medication management, or what does that look like?
Is abuse prevalent? Short answer, yes, it can
Mhm.
be. But again, it's always individualized. But a lot of times I see that a lot of people's past, whether it's abuse or whether it's a specific trauma or whether there's been a past experience that has happened, a lot of times those experiences have stuck with them. And it's
Mm,
hard to really shake those things. So they find that, those past experiences kind of guide their day to day. It guides how they feel. You have triggers that come about, and you could be having a good day, but something happens and you're right back in that same spot that you were in a year ago, 5 years ago, 10 years ago, 20 years ago. So trauma can breed a lot of the mental health conditions that we see on a day to day, whether it's anxiety, whether it's depression, whether it's PTSD, whether it's insomnia. You're not sleeping because you're having nightmares. When you're in public, you are always on edge, on guard, standing near the exits. You know, you get hot, you get sweaty, you get clammy in certain environments around certain people. So trauma plays a big role, in a lot of the patients that we typically see on a day to day.
Yeah. So these medications, because that sounds highly significant and like laborious to deal with. So are there any like reactions to these medications that you've seen that people should probably be aware of?
Are there any side effects to the medications that people should be aware of? So, at each visit, and I always say all medications can have side effects.
Mhm.
Um, Tylenol has side effects, depending upon how much Tylenol you take. So some medications can have side effects, whether it's nausea, whether it's vomiting, whether it's constipation, whether it's headaches. And a lot of times we expect some of those side effects. We just don't expect them to last. So when you first start taking the medicine, your body really does have to adjust to, this new way of life. It's not used to you're not used to the medicine, and the medicine is not used to you. So for those first couple of days, you may have some side effects. So I always encourage patients to be transparent. If you have some side effects going on, call me. Let me know. We can kind of talk through them, figure out if they're normal. And if they're not, then, we can always come up with a new plan. You do have other side effects that, may cause intense restlessness or, it may cause, maybe even more severe headaches, or you may break out into a rash, different things like that. Certain medications come along with certain side effects, but the main part of all of that is the education piece. So, regardless of whatever medication I put you on, we're going down a list of possibilities. We're going over the pros, we're going over the cons, we're going over the side effects, we're going over what may happen and what may not happen, just so you know what your benefits are, but you also know what your risks are.
Very good. So you mentioned insomnia, and like in my mind, if I can't sleep, what can I take that can help me sleep, but that won't, I guess, give me a negative effect? Like,
Yeah. Well, that's a good question. A lot of times what most providers will recommend is magnesium. Magnesium
Mhm.
is an over-the-counter supplement, and you can take that to assist with your sleep if you don't want something that's prescribed. You also have
Okay.
melatonin, which a lot of people know about melatonin. Not a lot of people know about melatonin, so that can assist you in, sleeping. But what I always say is, a lot of people have their own experiences with certain medications. Sometimes melatonin gives people nightmares, and they're like, "Yeah, no, that medication is not for me." So it really just kind of depends on the person, but it also depends on your nighttime routine and what that looks like too. So sometimes you don't need meds. You might just need to put your phone down. You might just need to turn the TV off an hour before bed. You might just need to take a hot shower with the lights off and a candle on. All of those things play a major role in what your sleep looks like, even outside of medications.
Nice. Okay, so we have a question. It says, what coping strategies can be used in between sessions?
What coping strategies can be used in between sessions? Those we during session we go over grounding strategies. We go over coping mechanisms. Whether you that anxiety may be high, and we are using those strategies that we have developed, because everybody's individualized, and a lot of times you may go home with homework. You may have to identify something good that has happened to you within that 24-hour span of time because you are such a negative thinker. We encourage you to use your support system. So reach out to your friends, reach out to your family members. If you're a spiritual person, you can, dive into your Bible or dive into, those devotionals. Therapy gives good headway. Some therapists do weekly visits. They see you a little bit more on a consistent basis than a medication management provider would. So that's why therapy should always, be involved as long as the patient is okay with it, because everybody is not okay with therapy, because people have their own, incidences where they just don't feel like therapy is effective. So between your sessions, there are different coping strategies that you can utilize outside of the medications, because we all know medications won't do it all. It just all depends on the individualized plan of care that we've came up with for that patient and how that looks.
Okay. Oh, they got the questions rolling in now. So this says, if they get on meds, do they have to continue taking them or get off of them at some point?
If
But they may have came in. Oh, okay. Never mind. So if they're the question is, if they get on meds, do they have to continue taking them for the long haul? I know we
no,
addressed it specifically,
yeah.
but yes, maybe they
So
weren't on. So,
oh no, that's okay. So if you start medications, medication does not have to be a long-term solution. It can be a temporary or a short-term solution depending upon what's going on. And it also depends on how you're coping. That's why follow-up appointments are imperative because we really ask the main question, is this medication benefiting you? Is this medication still serving you? Have you developed those coping strategies and those grounding techniques? Are you managing better on a day-to-day basis? Are you having more better days than bad days? So, at that point in time, we reassess. At one point in time, you may have needed this medication to be able to function throughout the day. But, 6 months down the line, 1 year down the line, you may be coping, better effectively, so medications can be tapered down and taken off the table completely. It all depends on the patient and what they prefer. And I always say what they prefer because they're the most important person in the room. So if at some point you say, I don't want to be on medicine no more, then we kind of figure out, okay, how can we make that happen?
excellent. So I know you mentioned titrating down. What does it look like if I need more medication?
What does it look like? Your symptoms may not be managed. So your anxiety still may be on 10. Those thoughts may still be racing. Your focus and concentration may not be where you want it to be. A task that you've been trying to complete for 7 days may still be undone. You may have those crying spells out of nowhere. You may not be sleeping like you may not be getting that 6 to 8 hours of sleep. You may be waking up, numerous times throughout the night. You may be angry and irritable without being warranted. Your coping may not be as good as you want it to look. So at that point in time, we look at the medicine and we look at, okay, we've seen some benefits, but we also can see more. We're moving in the right direction, but we're not exactly quite where we want to be. So in that arena, that's kind of when we decide together if a dose increase is would be a good choice at that time.
Okay. So the client is still part of this process. Now, are there mandatory regulations that you would look at to say, okay, yeah, we need to go up. We need to go up. Or is it just client specific? You know what I mean? So is it like if you see these symptoms over this time, we go up 5 milligrams, 10 milligrams? Or do you just work with the client? You know what I mean?
So
Is it
yeah,
like,
there's not a written rule anywhere on, medication titration and going up in dose.
mhm,
It all depends on what's being displayed in front of you. Because
mhm,
at the end of the day, what I feel like, okay, you know, I hear what's going on. I've heard how your last 4 weeks to 6 weeks have been, and things can be better. You may get a client to say, I don't want to go up. I'm okay. So there's no written rule. What I can say most of the time where I find that I am a little bit more encouraging with increasing medications is when, suicidal thoughts may come into play or psychosis comes into play, whether it's hallucinations, whether you're hearing things or you're seeing things, or you're delusional, where you may think people are following you, different things like that. There's no written rule that, medications can go up, but there are markers where increasing a medication should be suggested or recommended.
okay. So with that, can somebody hide behind like an addiction to keep from getting on medication? You know what I mean? Like, so they're self-medicating with alcohol, drugs, but they're telling you, hey, things are getting better. Have you seen that where somebody can hide behind alcohol or drug use?
Oh yeah, all the time. We have something called functional addicts. So, a lot of times people hide behind those things because, that's a mask that they're not willing to really peel off and that layer really hasn't been addressed. A lot of times as providers, we really don't know anything unless, the patient decides to disclose those things. I may have been seeing a patient for 6 months and at that, seventh visit, they tell me that they're drinking, four bottles of tequila in a day, or in a week, or, they're self-medicating with marijuana, or, they use opioids to kind of cope and mask, a lot of the symptoms so they can kind of feel numb. So unless the patient really discloses those things to us, we really don't know until their addiction starts to show them, itself, where, they may not be able to keep up with their upkeep. The way that they dress may be a little bit different. They may look a little disheveled where they may not be doing their hair. They may come in and their breath may smell like alcohol. They may come in and they falling asleep during their session, so then, as a provider, you ask those necessary questions to kind of dive a little deeper to kind of figure out what's going on, but essentially being a provider, you kind of have to be proactive and ask a lot of those questions um, in a judgment-free way, because a lot of people feel like, well, I can't tell them that. Then they may not want to help me, or they may not give me the medicines that, may be the most effective, or they may try to refer me to a detox program, or, it all depends on patient, is individualized. But for the most part, to answer your questions, can patients mask it? For sure. We see it all the time.
Well, as a ethical doctor, which I know you are, would you say to a client that's coming in for assessment, that alcohol or drugs will make what we're trying to do, not effective, you know?
Oh, yeah, for sure, for sure. So what a lot of people don't know is that alcohol is a depressant. So if you're already depressed and you're drinking alcohol on top of that, then your depression is probably going to be 10 times worse. And a lot of times it's exacerbated. In the moment, you may feel good, but once, the effects of the alcohol start wearing off, you find yourself in the same place that you were before, which is why a lot of people continuously find themselves drinking, because they want to feel comfortable, they want to feel numb, they don't want to really address you know those feelings. But I am very transparent. If you are drinking, if you are doing drugs on these medicines will not totally be effective, and they may not work at all, um and I think a lot of that comes with the education piece, so people, do know. You have providers out here that may do urine drug screens, or, they kind of check behind their clients just to make sure what you're telling me, you tell me one thing, but sometimes what people tell me may not necessarily be the total picture. And a lot of times as a provider, I may feel like I'm missing a piece. Like, okay, we've been seeing each other, we're on the meds, now granted, every medication does not work for everybody, but if I'm not seeing any changes, then we kind of got to figure out, okay, what piece to the puzzle are we missing? And a lot of times they may be drugs and alcohol.
Okay. So laboratory results will help you with your medication management process.
Yes, it will. If, I'm looking at a client who may be depressed and they say, well, and it could be new or it could be long term. Typically, for the most part, I always ask people if they have a primary healthcare provider and when was the last time that they saw them, you
Okay.
know. Um, And when was the last time that they got labs? Because sometimes, especially in the wintertime, your vitamin D low, then, a lot of times low vitamin D can lead to a lot of depressive symptoms where you're reclusive, where you're down, you're sad. You don't, the sun is going down sooner, it's colder outside, there's a lot of different things going on. A lot of people are anemic. So that can kind of interfere with, your anxiety, your depression. Your thyroid can have, some effects, on those things. If I'm looking at it from a substance abuse perspective, we look at certain labs as far as your liver is concerned. If I'm treating you for alcohol disorder, I look at those labs, those if those numbers are getting better, then I know that you really haven't been drinking and the medicine that we're giving you is working. So it all depends on, what's going on, if that makes sense. And you kind of have to look at the big picture and really critically think. Because a lot of people will come in and somebody will say, oh, I'm depressed. I got this going on, I got this going on, and a provider may just throw an antidepressant at them. And they may not really be depressed. They really may have something going on metabolically that really could be addressed, either by yourself or by a primary care provider, and an antidepressant may not be necessary. So it's always looking at the big picture and getting a full assessment of the patient and not just running to what you think your first diagnosis may be, because it may be a second one.
I love that. Now, just for the people so that they understand that Yes, you are great, but how does the DSM and other literature and like empirical evidence guide your practice?
Yes. So I DSM is like my holy grail. If you have to meet certain criteria. There are certain symptoms that have to be present for us to really make a diagnosis. If all of those symptoms are not present, then we really cannot make an ethical diagnosis. There may be some things going on and you don't really meet the full picture is not there, but we know some things are going on. So it's kind of like, okay, well, how can we address those symptoms as such? I am a avid reader, so I look at a lot of scholarly journals. I look at a lot of the research that's coming out. I look at a lot of the FDA approvals for medication. um how can this be of benefit, because a lot of times the older things don't may not work no more. It may be the newer things that work. There may be a diagnosis that I may not be aware of, but when you flip through that book, you're like, oh, okay. But collaboration is imperative. If there's something that I don't know, I am not afraid to ask. I will call my nurse practitioner friends. I will call my psychiatrist that I have worked with for years, and we'll kind of together figure out what may be going on, if if I'm unsure, or if the picture isn't clear, should I say.
That's excellent. That's so good. So if you guys understand what she's saying, hey, she's in the book and also she has a big heart. That's a very beautiful combination to have, especially in the mental health field. So we have some questions before I go to a quick little station break. It says, how do you see your practice growing over the next few years?
How do I see my practice growing over the next few years? um this practice will be a representation of what God can do in the mental health field. I see it growing abundantly, because what my goal is to do is to improve quality of life overall. It doesn't have to be medications. It could be advocacy work. It could be education. So growth for Sunflower Psychiatry and Wellness will be abundant over the next couple of years, if you ask me, because that's what my vision is.
That's beautiful. And listen, yes, I know that I'm going to definitely be working with you. It's like divine timing.
It
Like
is.
I
It
really
is.
We don't know her, y'all, but we know her. This is so amazing. So yeah, I'm excited. I'm excited for you and your practice.
Thank
And
you.
I know that because of your heart, because of your mind, because of your professionalism, that God is definitely going to smile on your business.
Yes.
And sunflowers are my favorite flowers. So listen, I'm excited. I'm excited. I'm excited. We're going to do
You
some
and me
good stuff.
both. You and me both.
So another question is, what advice would you give to someone who is interested in working in medication management?
What advice would I give to someone who's interested in working in medication management as it relates to being a nurse practitioner?
We'll say yes.
Okay. What advice would I give? If you want to deal with medication management, there is a stepwise approach that has to be taken. So you first have to be an RN, and then after your RN, you have to apply for graduate school to get a certificate. To do medication management. Medication management also accompanies those therapy aspects, so you should be able to do both. So there is a stepwise approach to education. So whether it's your associate's degree, then you have to get your bachelor's degree, then you have to get your master's degree. And traditionally, as long as you have your master's degree, you should be able to execute medication management. You can't continue to go further like I did and get your doctorate just to kind of enhance a lot of those skills. But it all depends on what someone is trying to do for themselves and how they want their careers to look.
Excellent, excellent, excellent. Well, Dr. Brittany Bagby, we have definitely enjoyed you. This topic is very broad. I can definitely see how there's so much, that we can unpack with the specific diagnosis. So we're going to take a quick little station break. And when I bring you back, I would like you to really just give us your closing remarks and also tell us how we can get in contact with you and also share how people can come to you for services when we bring you back.
Okay, I can do that.
Well, thank you so much for tuning in with us tonight. Dr. Brittany Bagby has been such a treat for us tonight, but we would like to thank our partner, House of God Worship Center, for creating this medium for us to address concerns and bring knowledge to you and the community. We ask that you join us for our Sunday services at 2510 Build America Drive every Sunday at 11 a.m. Also, House of God Worship Center will be having morning manna prayer this Saturday at 8:30 a.m. at the 2510 campus. So if you are in the area, please make sure you stop by and join us. We are excited for what God is doing in this part of the vineyard. Our leaders, Bishop Gary T. Rogers and Pastor Lisa Rogers, definitely exude excellence in everything that they're doing. So we ask that you just continue to follow us. We have our prayer that we will be hosting every Monday, Wednesday, and Friday on our Jumpstart platform. You can catch us there on Facebook Live, but also on the Zoom link. If you have our app, then you can go ahead and follow us and click watch live to join into any of the services that we are streaming. We appreciate you so much. And as I get ready to bring back Dr. Bagby, I will have that last question. I saw it. So we're going to ask her that question and then we're going to get her remarks. So, Dr. Bagby, would you join us?
I'm
Excellent,
back.
excellent. So, we have one more question before your final remarks. It
Okay.
says, how do you handle those who have been told that medicine is not of God, yet they are in need of it?
How do I handle that? Um, I think something that sticks out to me is that the phrase that we always hear um in the church, faith without works is dead. Um, I don't feel like that God looks down on people who take medication. If anything, he is praising you for taking control of your life and trying to be in charge of what that looks like, because you only get one. A lot of people may think, that medications are not of God. But he put those ideas in someone's head because he knew that there would be a time where someone was going to be depressed and they wanted to take their life, or he knew that there was a time when someone was anxious and they couldn't do what they needed to do to sustain a good quality of life, whether it was eating right, whether it was keeping a roof over their head, whether it was taking care of their kids. He knew, that there will be a time where your thoughts may take over and your mood may shift and your relationships may be impacted about, with how you feel. So I think when people say certain things about medications not being of God, I think that's where the education piece comes in. And I think that's where the support comes in. You can pray all day, and I'm not saying that prayer does not work. Prayer works, but there are still other things that need to be tapped into to get those prayers answered. You know, um, you have to do a lot of the legwork. You have to make certain choices for yourself. Every people can't make them around you. God can support you, and in those seasons, he's never gonna leave you, but you have to show up for yourself as well, in whatever way that looks like. So medication management may be an option. Is it an option for everyone? No. Is it an option for some people? For sure.
Excellent. You worded that very beautifully. I love that. So please tell us how we can get in touch with you, how people can connect with you, and then also any last remarks that you would like to have with our followers.
Okay. How can people connect with me? So we are in the office Monday through Friday, typically around like 9 to 4. You can call our office, 757-374-8839. If we do not answer the phone right then and there, leave us a message and we will call you back. You can always visit our website, sunflowerpsychiatryva.com. We check those inquiries within the 24-hour span of time. You can fill out an inquiry form. If you don't have the courage to call, fill out the inquiry form, and I will reach out to you and figure out how I can be of assistance to you. Um, so yeah, a telephone, website. That's typically how you can get in contact with Sunflower Psychiatry and Wellness.
Very good. Well, we have enjoyed you. I am looking forward to or what we're going to be doing collaboratively. Yes. So I'm so glad that you reached out to us. You are what the community needs. So thank you so much for your heart. Thank you so much for your knowledge. If you all need these services, please, please don't suffer in silence. If you find that you've been suicidal, there are resources available. And also you can dial the emergency number 988 if you definitely, don't have anybody that you can reach out to. But we don't want to lose anybody on our watch. So don't
Mhm.
let your mental health matters take over. We want everybody to enjoy this year and be successful, but also we want you to be well. And you can do that with medication. It's okay. All right. So we thank you for tuning in. Join us back here in February as we will have another amazing speaker and an amazing topic to share with you. And you all have an amazing evening. It's still early, so get out there and be well.
Have
Take
a
care.
good evening.
Thank you again, Dr. Bragby.
You're so welcome. It was a pleasure.
Good night.